Actually stop the recording, and I'm going to start it again once we get everyone admitted, so we don't have 3 minutes of beeps on the recording.
Thank you.
So once we get everyone in, Libby, give me the key or the cue, and I'm going to start the recording, and we can actually start for real here.
All right, give me a couple more minutes, or one more minute.
20 to go.
Provost Jones, did you see where Dr. Griffin has on a coat and tie?
He looks rather dapper.
I think he's trying to shame us all. That's what I think.
He is.
Shaming.
He's doing a good job of it.
And he has no comment.
I was in an empty Brooks Auditorium welcoming our future bridge students today.
Nice.
To get recorded.
Nice. Well, you're looking very sharp there.
Well, I am trying to bring up the class of this group.
I understand. We need people.
I'm talking about the administrators, not the students.
Clearly, we understood what you meant.
Hit that.
RSVP, so I just need to check on them, but you can go ahead and get started.
All right, I'm going to hit the record button. Give me like 3 or 4 seconds before we get started, okay? Hitting it now.
Well, good afternoon, everyone. My name is Philip Sykes. I'm a member of our strategic communications team here in University Relations, and welcome to our virtual town hall with CUSG and GSG. We want to thank you all for being here as we get set to discuss a number of important matters to the student body here at Clemson. As we get started, please be advised today's session is being broadcast live by Tiger Vision, thanks to our friends in CUSG. And also our session is being recorded by CCIT so that we can make it available to the broader student population following this meeting. We also ask that you remain muted throughout the introductions and Q&A portion so we can make this as efficient as possible for you. Today, we're pleased to introduce a number of panelists who've agreed to join us today from the university. We have Bob Jones, Executive Vice President for Academic Affairs and our Provost. Chris Miller, Interim Vice President for Student Affairs and Dean of Students. Mark Land, Vice President for University Relations. Lee Gill, Chief Diversity Officer and Special Assistant to the President. David Fleming, Interim Associate Provost and Dean in the Graduate School. John Griffin's with us. He's the Associate Provost, Dean of Undergraduate Studies. Greg Mullins should be on the line. He's Associate VP for Public Safety and our Chief of Police. And we have Rick Patillo, Chief Financial Officer. We also have several student leaders on the call, obviously, including Jonathan Gandana, Undergraduate Student Body President, Hunter Bond, Undergraduate Student Senate President, Caitlin Sammons, Graduate Student Body President, and senators and executive leaders from both CUSG and GSG. We want to especially thank Jonathan, Hunter, and Caitlin for bringing this group together and for your display of leadership throughout the COVID-19 pandemic. So before we get started with our Q&A, I would ask Provost Jones to kind of make a few opening remarks about last week's announcement. The university would be delaying in-person instruction and provide a brief overview of our current operating status.
Thank you very much, Philip, and thank you all student leaders for how well you've been engaged with the very serious challenges that we have with the global pandemic. What an interesting and challenging and sometimes scary and disappointing and situation that we are all facing together. And your steadfast leadership, being professional and aiming towards doing the right things and helping us all do that is much, much appreciated. So I'm going to just start very briefly about this disease. It's a pandemic. It's a new virus. We don't know much about it, and the knowledge of the disease of the virus is evolving daily. And because of the uncertainty of how it works, it makes planning extremely difficult. You have to just get on it and work hard, and keep learning the new findings and integrate science into your thinking. We know that age is a big factor in severity of the disease, but what we're finding out now is that young people are not immune and aren't going to be affected by this. In fact, more and more studies are showing more and more very serious impacts on young people, including long-lasting impacts, severe symptoms, risk of mortality. The data are showing higher and higher and higher risks in that age group. So this is not something that's important for particular age groups. It's important for all of us. And that's been really shaping our thinking about having a safe campus. It's not just for employees. It's got to be safe for our students. One of the things that we do is we try to put how the disease behaves into epidemiology modeling. And that means we're trying to project that infection rate and what those severe impacts or not severe impacts might be if we use different modalities for protecting ourselves, different kinds of strategies to stack upon each other, like face masks and social distancing, that can help mitigate the risk and keep the infection rates low. We've engaged health experts from around the country, including several right here at Clemson University and MUSC, and also Dr. Chris Kalenda, who's an internationally renowned medical administrator, scientist, physician, and actually has a public health degree on top of that. And we've been running different models and scenarios predicting what would happen if we have this many students, this infection rate, and so on and so forth. And it turns out two variables drive all the models. One is the reproduction rate of the virus. It tends to be around 2. That means one person will infect 2 people, and they will infect 4, they'll infect 8. So unto itself, it's going to spread and grow. But you can reduce that infection rate by things like masks, hand washing, social interactions, and so forth. The other key point, and this is a key one to know, is what is the base rate of infection? If it's very, very scarce, you have an easy chance of controlling it. If it's prevalent, it's very difficult. And you know what's been happening in South Carolina. We have runaway growth. So that has changed the landscape as we put together our plans for having primarily face-to-face learning, but with social distancing in our classrooms and a regular start date on August 19th. In fact, what we saw in the models, because of the infection rates rising, is no matter what kinds of mitigations we put into place, very rapidly the student population would have 500 or 1,000 or thousands of people infected all at once. And one of the procedures we have to follow is to quarantine. And can you imagine if we had thousands of students sick or infected all at the same time? We may have to actually quarantine whole dormitories. Logistics of helping bring food and cleaning and all kinds of other things, and the pain and stress that the students would be going through in those quarantine situations, it became totally untenable. And because of that, we reluctantly had to make the decision that to protect our students with this high infection rate in South Carolina, we needed to pivot to a new strategy. So last week, as you all know, we made the announcements. We're changing the dates in which we're going to move into the dorms. and then start up our face-to-face learning mixed in with online and blended learning. And that's going to happen in September. Meanwhile, the silver lining is that gives us a chance to see if South Carolina can start getting a handle on and begin driving down the local infection rates. There's a glimmer of hope already starting to happen in the data. And we can do more serious and in-depth testing of students who are already in town. We're testing our employees now with those testing strategies, watching the changes that are coming up, learning from other universities. We have a fairly high degree of optimism that we are going to be able to open the dorms and have that face-to-face learning in September. The decision-making on all of this is with the medical experts, those modelers, and engaging faculty, staff, students through the EOC, input, ideas, thoughts, what's important, what do we need to do, can we work together, working with student leadership, can we put those behaviors in place to drive down that infection rate R down to less than 2. It's a team effort, and we have to continue that team effort going forward to have our opportunity to get this semester with a good chance of 9+ weeks of that face-to-face learning. Meantime, this is not your plain old pivot to online learning like we had to do in spring. This is way, way, way more sophisticated learning that's going to have interactions. Are going to be face-to-face over Zoom, discussions, breakout groups, there'll be projects, presentations. They'll have GoPro cameras that'll be showing dissections and other sorts of things in live discussions. So it's going to be far more complicated, complex, and challenging in the classroom. And many, many of the campus experiences are going to continue with lots of discussions, group meetings, reach outs, events that are going to be virtual, not a full substitute for face-to-face, but it's going to be far more enriching between now and September than one might have imagined. And we're really looking forward to that. So that's my introduction. We're going to continue to use science and data to drive our decision-making. Number one goal for us is to have safety and health of our students and our employees. And number two is to make sure whatever we do is an enriching experience and high quality, the things that Clemson must do, what we take pride in doing in terms of our education.
Well, thank you very much.
Thank you, Philip.
Thank you, Provost Jones, and we'll get back to you during the Q&A portion very soon. Obviously, this has been an interesting time around the country. It's not just because of COVID-19, but also certainly there's issues surrounding race, diversity, inclusion, and Clemson has been part of that conversation. Last week, I believe it was, or maybe it's this week, the university announced the formation of a social justice and equity task force, which will be chaired by Lee Gill. Lee, if you would, please provide our students with a brief overview of the task force responsibility, and also any other comments you'd like to add about the university's efforts for this summer on issues of diversity and inclusion.
Well, thank you so much for this opportunity to be able to share with our students some of the I think innovative ideas that the members of our leadership team, our executive leadership team, members of the president's cabinet have begun to put into place. As many of you are aware, there have been so many groups across campus, faculty, staff, our student organizations that have, quite frankly, responded in some amazing ways since we've been seeing what's taken place over the past few months, few weeks regarding social justice issues around the nation and, quite frankly, around the world. And President Clements wanted to make sure that while we have so many different groups across campus working, and not only across campus, but also externally, our alumni, people who have attended Clemson in the past have been watching the news and are concerned about the direction that Clemson can take as we forge ahead in our leadership role. So many groups have been working, many of them, quite frankly, on this phone call right now. John Griffin's group, Chief Mullen group, Chris Miller, Dr. Chris Miller and I, along with Provost Jones, we had groups. Our President Leadership Institute, been working and developing recommendations. Various undergrad student organization, graduate student organization, so many different groups from across the entire campus have been coming together and devising and developing ideas and recommendations as to how we can make Clemson an inclusive place, a more inclusive place. How do we ensure that the campus climate is embracing and welcoming of everyone? And so the president directed myself, along with Provost Bob Jones, to utilize our diversity council as an umbrella to gather all of this information that has been bubbling up from so many sources, as I've already mentioned. Bring all of those ideas together under a task force model and formulate, gather, analyze, put them into an Excel spreadsheet, but more importantly, ensure that all of these ideas are transparent. And so we're working with CCIT. There'll be a website developed shortly. So many members of our leadership team, our executive leadership team, their members are part of this task force. All student organizations are part of this task force. Deans are part of the task force. But the Diversity Council, which has a broad reach throughout the entire campus, will work through all of the various recommendations, put them in a format where the university can watch in real time, because transparency is so important. But our ultimate goal is, how do we ensure that everyone is a part of the Clemson family, not just in words, but in deeds? Just how do we ensure that everyone's voice is listened to and heard? And so what you're going to see, and I'm so pleased to have this opportunity, what you're going to see in the next few weeks, quite frankly, are recommendations, are initiatives that will be rolled out, are plans that are being put into place, and that's going to make this university continue to grow and be the embracing, valuing university for all of our faculty, our staff, and students. Under the president's direction, along with the provost, and as I said, many of you on this phone call, on this Zoom, I'm the one calling in. This is an exciting time in Clemson's history. And I think we have the energy and the passion of so many people that have been working so hard and who've contributed so many great ideas already to bring a true reality to moving Clemson forward in a very positive way.
Well, thank you, Lee. And one of the reasons you're calling in, I understand, is because you're on vacation. So we definitely think
that's true. Plus, I got a chance to see my granddaughter. I'm a grandfather now, so that was the other part.
That is fantastic. So, well, now it's time for our Q&A, which we sort of kind of divided up by topic. We received a lot of great questions from everyone in advance, and we've shared them with our panelists. To be respectful of everyone's time, we're just going to jump right into it with the goal of answering as many of them as we can throughout this session. And our goal at the end is to allot time for both Jonathan, Caitlin, and Hunter to address any concerns we may not have had time to touch on during the session. So in the area of academics, getting back to Provost Jones, John Griffin, Dave Fleming, you can imagine a lot of questions right now, the calendar, in-person versus online instruction. Let's get into some of those questions. The idea of taking a gap year, deferring a semester or potentially longer due to COVID concerns, will scholarships be retained for students if they pursue this route?
I can speak to that one. And generally speaking, when you ask for a deferral, you should have all of your scholarships protected, but there are a lot of nuances and differences in different kinds of scholarships and different impacts on your personal finance. And it's always highly recommended, I think really necessary, to go ahead and just have a brief conversation with the people in financial aid, because there are so many complex state and federal rules that are around scholarships. But our strategy is any kind of scholarship we control. If we're trying to bring a person on and we've committed to a scholarship and they ask for a deferral and we grant it, it's our intent to continue that support.
Is there an option for higher risk students to attend solely online amid these health concerns, such as someone who may have an underlying issue, if the university does opt to return to in-person instruction?
And I'll be happy to take that one. We've been very aware and working with students who have called our student accessibility office about this desire to be fully online, especially around health concerns. We know there are other students who have concerns around just being in a stressful situation and returning to in-person classes. We understand those. Just this week, we've put a process in place now where students can opt into and be approved for fully online for the semester. That will allow you to even if we come back, stay in that online mode of course delivery. If you're interested in this, if this is something that applies to you and you're seriously thinking about wanting to have this in place before the semester starts, please talk to your academic advisor. And if the advisors have been informed of the process, there's a simple application. We're not asking for any kind of confirmation or documentation. If you ask for it, we'll walk you through the process so we can approve and document it so that your instructors will know that you're only going to be in the online portion of each course. Recall that we set up every course this fall with the ability to pivot online. We've had a lot of faculty working very hard to create courses that can accommodate both online students and those students coming to the classroom. So if you're interested in this process, talk to your advisor. If you can't get a hold of your advisor, talk to Margaret Camp in the Student Accessibility Services Office. Again, we're not looking at this as an ADA compliance. Everybody who wants to will be approved, but they're running the process for us. And if you can't get a hold of Margaret, please call me and I'll hook you up into the process. But we have put this in place this week and we'll be working with students before the semester begins to get those documentations and approvals in place.
Couple of questions about related to the pass-fail option. I think we implemented that late in the spring term. Wondering if that would be an option for students in the fall, and also if the final date to drop without penalty would be pushed back due to this delay in in-person instruction.
Well, we clearly saw a need for both of those in the spring because of how quickly we had to pivot, and it was tough on all of you as students. It was tough on our faculty, who were not thinking that this is what they would have to do in the middle of March, middle of the semester. So those were appropriate at the time. At the moment, we are not planning on changing any of the calendar dates that we have for the academic calendar for the year or put in place the special grading policy. So we really have taken the time to work with faculty. Many of you will see that faculty will start reaching out to students in the next couple of weeks as they start to really plan their courses or getting the calendar, the scheduling in place so they know what rooms they're going to be using when you do come back to campus. And so we really have done it differently. And we know those grades are valuable. And that's an important piece to remember, that if you're applying to graduate or medical school, you really do need to have those grades in place. So unless the national landscape changes where everybody is using these grades, we'd be putting you at a disadvantage. So at the moment, no, we don't have any plans to change the calendar or use special grading.
Thank you, John. Study spaces, that issue has come up a little bit. We know that there's conversion of non-traditional spaces into academic classrooms. So what does the study space allotment look like at the university? If there
Well,
were,
I'd like to introduce Phil Landreth to answer this question. Phil's on this call with us, correct?
Yes, I am.
Go ahead, Phil.
So that's a great question. We've just completed a report showing all of the existing student study spaces around campus. In addition to the Cooper Library, we understand that all of those spaces are going to be less than the normal capacity because of social distancing requirements. So our team is in the process of going through and restricting those areas and roping them off or removing the seats to make them easily identifiable for being socially distanced. And I'm going to ask Dean Cox with the library to administer that student study space inventory, just like he and his staff do during midterm exams and during final exams during a normal semester. We try to have that run through the library. We send it out. Philip helps us send it out over social media too, so that all the students can access that inventory and kind of know where those spaces are available on campus to go to. Also, keep in mind that we've got a faculty member in industrial engineering, Mary Beth Kurtz. She's got an optimization algorithm that she's trying to help us with, so that if you had a Monday, Wednesday, Friday class, for instance, and your day to be in person is on Monday, she's trying to get it to where all of your classes, in-person classes for the blended model, is on that Monday, so that you decrease your interactions with other students to minimize your risk from COVID, of course. Also, it will help commuter students to not have to come to campus and try to park, so many days out of the week. So we're trying to minimize and optimize that, and I hope that'll be very helpful too. And hopefully that will minimize the numbers of students on campus any particular day to where those study spaces would be plentiful. Keep in mind too that any classroom that doesn't have a class going on in it will be open, and the social distance numbers are posted on the doors going in, so students feel free to use any of those available classrooms that aren't being taught in to study between classes.
Thank you, Phil. Dr. Fleming, a couple of questions related to international students. How are they going to be impacted, first of all, by travel restrictions? And secondly, very specific to CUICAR, when should international students anticipate updated information on I-20s?
Okay, yeah, thanks, Phil. Important questions and for important student population of ours. International students are a key element to our research and graduate education enterprise here at Clemson, and we've put a lot of effort on trying to focus on some of these moving targets over the last couple months. So the students that we have, continuing students, the first thing we did is frankly encourage them not to return home if at all possible over the summer term. We didn't want them to get caught in a situation where they would have some difficulty coming back, and our international services office has been key in helping to keep a beat on the number of students and where they are. I think the total number was 38. So the bulk of our students ended up staying here over the summer and being able to continue their enrollment here at Clemson. For those other students that did return home, International Services is tracking their ability to get back, and from what I understand, that they're going to, most of them are going to have be able to do so. Now, for anybody that's not able to return, or for new students who have applied and been accepted to come to Clemson from an international location but are not able to get here because of visa issues or because of travel bans, we have extended the opportunity for students to enroll online. And if it's a continuing student that they can't get here but can enroll online during the term until they can get back over here, great, we'll support that. And for new students, they have the opportunity to enroll online. I'll also say that we pursued another idea where we wanted to ensure that students that were admitted and offered, for instance, a teaching assistantship but couldn't get here, to try to set up an avenue to be able to support that. And so what we've set up is an international teaching fellowship pilot program for new international students who are unable to get here because of visa challenges. And that's rolling out now. And so we have an additional opportunity that we've extended to students that have those challenges. I should say that a lot of our peers are the only options they're exploring are deferring. And we just didn't want to leave deferral as the only option for our international students, or to take a leave of absence of some type. So we explored as many opportunities as we could to be able to support them. And then that second question you asked about with CUI car, I think it was having to do with changes for their I-20s. Well, the Immigration Custom Enforcement and Student and Exchange Visitor Program, with their guidance on July 24th, actually stated that the I-20s would not have to be redone. So whatever is already in place is going to be fine for them moving forward. So they don't need to do anything further.
Outstanding. And just the last couple here in the topic of academics, research and labs, how are they affected by going online? And then what protective measures would be in place for, let's say, teaching assistants if we do return to that in-person instruction?
Sure. So for our graduate students that are engaged in teaching in-person classes, the same protective measures are going to be there as we have for faculty. So the social distancing that's been set up in the classroom environments, the limits of the number of students that will be in that setting, the requirements for face coverings, the student code of conduct on top of that to help with some compliance with that. But of course, I hope that there's going to be enough social norming that we're all going to basically pull our oars together and do the right thing there. So the health and safety within the classroom is paramount, and that's for faculty and graduate teaching assistants alike. As far as the research and labs are concerned, when we pivoted in the spring, we set up a process by which some of our research could continue in an appropriate way, in a healthy way, safe way. And that's going to continue moving into this fall term as well. So for where we can basically get on our lists with our vice president for research to be able to continue those activities from a GRA standpoint, that'll be done through their PI, the principal investigator of the project, or the person that's mentoring their work. Of course, we'll have to have the same type of health and safety protocols in a lab space with social distancing, and there may be some different scheduling going on in labs to ensure that we don't have too many people in that setting at one time. So some flexibility there as well. But the research mission at Clemson is a strong one, and one that we want to maintain and will continue.
Thank you, Dr. Fleming. We had a few questions come in. Well, shifting gears a little bit to tuition and finances and fees. We've had a few questions come in related to the financial impact the university is certainly feeling from this pandemic. We're happy to have our CFO, Rick Patillo, join us today. Rick, questions related to tuition. I mean, students wondering if there will be any refunds available if the entire semester were to move online, and also if it would be altered in any way because of the move to virtual model of services such as, fitness centers, library, intramural sports not being available to students.
Yeah, thanks, Philip. What the university has announced last week when we moved to the first month, approximately being in online mode, is we have refunded housing and dining fees on a proportionate basis. So housing, for example, is a 29% credit against bills, and dining is a little different because depending on whether or not you have an unlimited plan, but similarly 29% credit against kind of those unlimited base plans. On the more academic fee, or E&G fees, the mandatory fees, we have also provide a similar credit to on fees that are, I think the three were the transit fee, because obviously if students aren't on campus, they're not, some are using transit, Tiger, I think the red route is still running, and we're not going to be able to keep everybody off of that, but realizing the vast majority aren't. Transit, the campus rec fee, to I think the question on fitness center, and then also the student activity fees, recognizing that the vast majority of students probably wouldn't get to partake in what that fee pays for. But to the question about tuition and the majority of the academic fees, those are not being reduced. I think there is a sense that, and understandably so, that there is some cost savings to the university that by operating in a online environment, and I wish that were true, but it's just not the case. We have a lot of folks working overtime and working real hard to make sure that we're delivering those programs and focusing on delivering programs rather than just cutting corners to get it done. And just as another example, we're projecting the university is going to spend anywhere between 18 and 25 million dollars to help institute some safety measures and bring folks back. So this is certainly not the move to online. Has certainly not been a windfall for the university, and so we're committed to delivering the programs.
You mentioned the student activity fee. We had a question come in specifically related to student organizations and their funding. How does that get impacted with the, I guess, move to online instruction?
Yeah, we have refunded the student activity fee. I think when that happened in the spring, and the basis for us doing that was to be consistent with what we did in the spring, and recognizing that that those are fees that students aren't necessarily going to get. All students aren't going to get the benefit of, even though it's applied to all students. In the spring, I think when that happened, we refunded the fee, but some orgs had already kind of spent the money. So there was to some extent, the university kind of ate that. But I think at this point in the year, going into programming, I understand that there's probably folks that were counting on those dollars. I would encourage you to reach out to the folks in student affairs. But this is a time when a lot of people are having to look at what they do with their budgets, and I would encourage the student organizations to do the same.
Question about health fee as it relates to students. Will they have a full use of those services in the fall, and what all does it entail?
Well, I'll let Dr. Miller speak to the specific services that they're going to offer, but I will share that the university is spending significant sums of money on testing and medical protocols that and Redfern, while just because we're not in person doesn't mean the folks at Redfern aren't busy. I know they're doing, and Chris, correct me if I'm wrong on this, telemedicine, CAP services. I mean, it is, they are there and they're a resource, and they are running, very full in terms of their workload to try to get everybody on campus and safe. Dr.
I
Miller.
can, yeah, I can certainly add to that. Thanks, Rick. Redfern has not closed any of their operations since the beginning of the pandemic. And they've also been one of our significant consultants on the clinical side, on the medical side, during the whole pandemic as well. And Rick had mentioned with the telehealth and telepsychology, not to mention the testing and various other kinds of things in terms of the services that are in fact provided and that have continued to be provided during the course of the entire pandemic. We see more and more of that. No, there aren't any plans in that regard because of the level and the functionality of health services. And Rick had mentioned too, for those organizations, they should contact those individuals over in student organizations in terms of some of the organizational kinds of commitments that were in fact made. But the university has been very, very responsive by way of refunding and crediting and all those other things that happen as it relates to not being able to participate in any real way as such. But I will tell you that REC will continue to provide some of the virtual kinds of fitness opportunities. So you'll continue to see those pieces. But I know we feel really good about credits and refunds and those kinds of things.
Thank you, Dr. Miller. And
Philip, maybe just one component to give everybody context. As of the bills that posted, we've refunded about $11 million in fees, and obviously the vast majority of that is in housing and dining to Clemson students that are enrolled at Clemson, and another 1.9 million refunded in fees to students that are in the Bridge to Clemson program. So it has been a meaningful refund.
Thank you for that clarification, Rick. The move to online instruction has caused a delay in the move-in process for on-campus housing, which we had been obviously scheduling for mid-August, excuse me. We've got a few questions related to the residential experience, and I'll ask Dr. Miller to jump back in and address those. First of all, will extenuating circumstances be granted for early move-in on campus?
That's a great question, Phil. We're taking into consideration any and all requests for exceptions that may come about. Um, it is challenging, as you know, the rationale behind the whole decision to delay the actual start date. I was on a call today from our Dallas chapter of the Alumni Association, and that was one of the biggest questions too. You know, how are we going to go about these kinds of things as such? But to answer the question as it relates to of housing and residential life, um, we will entertain any and all requests that come by way of exceptions, bearing in mind that our experts and epidemiologists and all the consultants, clearly have identified that this delay is an important factor in terms of the virus abatement. But yes, we will in fact entertain any requests that come by way of exception.
In terms of students who may get sick or exposed, we know there's been a lot of work done in terms of isolation and quarantine protocols. Kathy Hopgood and her team in Housing and Dining have been very busy addressing some of those questions, identifying spaces. What is the process at this point if a student were to test positive or has been exposed?
The university's been very deliberate in this regard. And as the provost had talked about earlier, all of these decisions have not been made in a vacuum. Um, I think Chief is on the line too, who heads up the Emergency Operations Center, and he may want to weigh in on some of these as well. But there is a definitive plan as it relates to any student, any and all students who do in fact find themselves infected by the virus in terms of quarantine and what that looks like. There is a special protocol which is consistent with what the CDC says and also DHEC about how we go about doing that. And the university has made significant headway in creating that. We've reached out to various partners, vendors, which apartment complexes that are adjacent to the campus, and have actually taken several apartments there that we've paid for the course of the year in the event that we do have to quarantine students in that way. We know that there are other pieces that go with that, and we're really well prepared to address that issue. If anybody else, any of my other colleagues want to address that, they certainly can as well.
Well, it's certainly a robust, response because it includes things such as laundry service,
Sure.
meal
Right.
delivery. If you're an on-campus resident, I do know those things. So,
Right.
in terms of activities and events, Chris, the experience outside of the classroom, if you will, with the semester beginning online, obviously a lot of things are affected. What is the latest you can tell us about students who've graduated in May and August?
Well, as the president had said, we still plan on having a graduation, and we're also planning to pivot in the event that there is something or if there are exigent circumstances, of course. But we still do plan on having that. I think I do need to speak specifically about the campus experience, both in class and outside the classroom. It will be different. It will be different. We'll continue to address these issues with respect to the pandemic. When we talk about social distancing, physical distancing, it's of the utmost importance. We talk about utilization of facial coverings. I mean, we know that these are things that will in fact abate the virus. So we'll see those kinds of mandates on campus. Large social gatherings, and we know that there are several of those things that have been canceled. Right? I mean, someone asked me on the Dallas call, Could I give an example? I said, well, the president's picnic is one of them, right? I mean, we have thousands of people that will show up for that at any given time. There are other academic kinds of things that we have that will be canceled as well. So the experience will look different, but we're making every effort. I mean, we're doing everything that's humanly possible to still create an experience which mirrors that of Clemson, right? So as time certainly progresses, you all will hear more and more about those things. But bear in mind, our goal is to be very deliberate as we adhere to various recommendations, once again from the CDC and DHEC and others, and trying to make sure that you all are going to be safe.
Dr. Fleming mentioned this earlier. He mentioned the idea of compliance or non-compliance as it relates to the student code of conduct. So when it comes to making COVID-19 related changes within the code of conduct, will administrators seek approval from CUSG and GUSG leaders prior to those types of decisions?
What we have done is we've consulted with legal counsel on various kinds of tools that we could use, which is not inconsistent with what other universities may or may not be doing. This is what we do know. There's absolutely no way we can adjudicate ourselves out of this. We also know that we're going to need students to help in this regard, that we cannot be successful in lessening the effects of the virus without students. And the whole concept of social norming, and I talk to my colleagues all over the country that we have students here that are absolutely and completely engaged. And what I mean by being engaged, the students and all of you that I've had the fortune of working with, which are indicative of our correct student community, think about things outside of themselves. And part of that is looking at the greater community and how do we protect all of us in the best way possible. So a lot of this is going to rest in the hands of our students, and making sure that we're doing all the things that are necessary. Now, there is a component within the code that does specifically address the issue of non-compliance as it relates to these types of public health issues. And it was, in fact, included as an amendment to that. I think it's important by way of clarity, but I don't anticipate us having any significant kinds of issues with our students that fail to comply with those university mandates. I've had too much experience, you know, working with our students, and I know that they view this as part of being a member of this collective social compact. And I know we're excited about it. We're excited to getting everybody back on campus. I think once again, an answer to the question is yes, there is a component with regard to public health that has been added to the code. And I believe it'll be like most anything on this campus, that students are 99% in compliance because they believe in it, they understand it, they appreciate it, they support it, and I don't anticipate seeing anything differently.
With the topic we're calling health, safety, and testing, kind of a big bucket that has drawn a lot of interest from folks right now. We're fortunate to have Chief Greg Mullen with us tonight. In addition to his duties as our Chief of Police, Chris mentioned earlier that he serves as our Emergency Operations Center Director. And so he's been lockstep with this whole process since way back in January when we first had meetings that the coronavirus was getting started. And so Chief, just curious if you can help us answer a couple of these questions. Will testing be readily available to students on campus or in close proximity to campus?
Thanks, Philip. One of the things that we've been working on, obviously, is to make sure that we have testing availability on campus or near campus. So that is last week we started our first process that would allow us to actually have testing. We did about 1,900 people, and we've been getting the results back from that all week long. We are in discussions right now with our partners from MUSC to actually lay out the logistics of how that would work with students and faculty and staff coming back to the university. So we will have some firm plans on those dates in the very near future. But our goal is to make sure that we have that testing available as close as possible for those students that are either on campus or living in the Clemson area, as well as those students that are out in our innovation campuses, our RECs, and outlying areas. So we've got a very robust partnership with MUSC, and I think that in the very near future, we'll be getting information out that we'll share with all of the community that will help answer any of those questions about the testing. But our goal is to make sure that that is as easy and convenient as possible because we're going to be utilizing that throughout not only the return, but also as we move forward to just make sure that we're staying on top of that and that we're not seeing any surges, because what we don't want to happen is to have to have a large surge in the area. And we believe that if we do this testing on an ongoing basis, that we're going to be able to identify that quickly so that we can isolate and quarantine so that we can continue with the academic learning process as well as keep the campus open and continue in that in-person learning.
I don't know if any of our medical experts are on this call tonight or not, but maybe you would be able to answer this, Chief Mullen. But are there any qualifications that would allow a student to be exempt from the required COVID test that we're asking folks to take before they come back?
There are some exceptions. I'm not going to get into the specifics of that because I'm not a medical provider. But there are some exceptions, just like there are exceptions for other immunizations. I would refer over to our medical folks if there's a specific question about an exception. But I do know that they will be very narrow. And the reason for that is obviously we want to make sure that we're keeping everyone as safe as possible. And we believe, based on our medical consultants, that the best way for us to do that is to have a robust testing process. And we've already really, in my view, demonstrated the success of that with our athletic department, which has been testing for some period of time now. And it was reported last Friday that they have no positive tests in their returning athletes. So that testing component is going to be very important, and therefore we're going to want to have everybody participate in that to the extent possible. But I'd refer you to the actual medical providers for what those exceptions would be.
And finally, how does the university plan to work together with the city of Clemson to enforce pandemic response guidelines? So we've seen that in action already. They mandated face coverings in public places through a vote of the city council. So how are the university and city working side by side to help mitigate this thing?
Well, we've been working really well with the community from the very beginning. We've been having weekly calls with the administrator. We've been briefing city council not only on what we are doing, but we've been hearing from them on what their plans are as well in terms of how they plan to mitigate. We've also been very engaged with the police department to share communications. All of their digital messaging will be pretty much mirrored what we have on campus. Obviously, we've been working with the local police department to try to communicate. What we want to do collectively is have voluntary compliance in terms of the request on face covering, social distancing, no large gatherings. Early in the spring, we did see some of those large gatherings, and there was a lot of social media and other things that came up about that, and it was not a very flattering um, um, media attention on Clemson. And what we want to do with them is make sure that we're working with the student body, that we're working with the student leadership to make sure that we have that social contract that Dr. Miller was talking about. Because in reality, there's no way, as he said, that we're gonna either enforce or regulate our way to a safe environment. And it's going to be all of us working together to co-create this safety environment that will allow us to continue to do the things that we really want to do, which is provide that academic and Clemson experience that's been discussed already. We want to be able to have events. We want to be able to allow people to come together and experience athletics. And the only way we're going to do that is if everybody plays their part, whether that be through peer intervention if you see people that are not wearing masks. If you uh, hear about large gatherings, we're asking you to please share with your friends and your peers that that may not be the best solution and it could create problems for everybody. So we're all in this together. I think we all have a piece of the answer. And if we work together as a collective body, uh, not only on campus, but also we know that there's, 16 plus thousand college students and the faculty and staff that live off campus. So we've all got a responsibility for safety for each other. And I think the collaboration that we've had with the city will continue. We're talking with them over everything from mass to communications to how we're going to handle athletic events that bring large crowds to the area. So we are very much engaged with the city. I'm very pleased with the communication and the collaboration that have taken place so far. And I've seen nothing but support from the city in terms of getting the students back, making sure that the campus is successful, and that we as a community are prosperous.
Thank you, Chief. As we go through the various scenarios of what a return to campus looks like, this question may be best for Provost Jones, but what do COVID numbers need to look like in our state and region to be able to return to in-person instruction? So to stick to our plan.
Thank you, Philip. Okay. Thank you very much. So this is an important question. Many people look for a single number and it's like a switch point or trigger. The fact of the matter is these models that project our infection rates have multiple variants. They're multivariate models. So in general, we want to see some of these things happen that feed into our model and then give us comfort that we will be able to manage the infection rates when we run our models. First of all, that overall community infection rate, which is very high in South Carolina right now, we want to see weeks of the rate of increase declining. And then ultimately for the levels of infection in terms of proportion of the population to go down, down, down. That trend is really, really important. We really need to see, as the chief pointed out, really strong engagement of the whole community, students, employees, the town, with the kind of behaviors that are going to help us keep the infection rates low. In our sequential testing, we're surveying constantly, probably weekly, a sample of our population. We want to see steady rates, that we're not seeing an increase. And if we can see steady infection rates, that means we're holding the line and all the things that we're doing are working. So it's sort of a combination of all of those things. And we also have a fairly unique kind of sampling. We look at the effluent in the sewage systems. And we have some scientists here at Clemson University that are nationally renowned for this work. And they're looking at viral particles. And that gives us a sense of the community's infection rates too. And if those numbers look well behaved, then we've got a lot of things that give us comfort that we're going to be able to stay the course and keep that face-to-face learning. There's no guarantees. We have to have all those things work, but we are really determined to make those work. And I know you are too. That's what gives me extra comfort. It's been watching your commitment to help make this work.
Now, my favorite portion of the program, communications. I'll ask Mark Land, our VP for University Relations, to jump in now as we discuss kind of the ways through which we're communicating with students and other constituents, faculty, our staff. Mark, how often are students going to be receiving communication as we get closer to the start of the fall semester?
Well, hi, Philip. Thank you. First of all, thank you for setting this up. And I want to thank our student leaders. A couple of reasons. First of all, seeing all your faces is a great reminder of why we're doing what we're doing. So it's great to see y'all. But beyond that, I can't even imagine how difficult it is for you all to be living this as students, but to be layering on a leadership role on top of your actual just trying to be a student role is very impressive, and we are very appreciative of everything that you all are doing. So thank you for that. Just real quickly here, because I know we're getting up against the clock a little bit. We are. I think it's fair to say we're going to use every tool that we have. We're fortunate in that Dr. Miller does a terrific job of communicating with Philip's help, of communicating directly to students. And so as we get closer to that, to the start of the school year, I think you can expect to see the official communications, from student affairs ramp up with, and what you need to know too is it's at any given moment, the communications that are being held are being made go well beyond what any one of you see, because a big majority of what we're doing as communicators is communicating to targeted audiences, right? So it's not, so what any one group sees is just a small piece of what we're doing, broadly, to make sure that everybody has the information they need to know, but we're not overwhelming you with things that you don't need to know. And that's a really important, really important point, I think, for you all to consider. And even when you cooperate, when you communicate with your own constituents, everybody says, well, you need to tell us, you need to tell us, you need to tell us. And that's true, but the information needs to be accurate, and you can't get so swept away by this feeling of urgency to communicate in a rapidly changing environment that you say things on a Monday that are going to be outdated on a Tuesday. And that's one of the challenges, right? So we're going to continue to communicate to you as aggressively as we can, with it, but doing so in a way that allows us to be confident that we're giving you accurate information, and that it's going to be information that's not going to be immediately outdated. From a big picture perspective, and Chief did a great job of explaining this notion of social compact. I want to tell you a little bit about an effort that we've got. It's called United as Tigers. It's our Healthy Clemson campaign. We have started messaging to the entire university community about what we're doing to keep, not only what we're doing to try to keep people safe, but what each of us can do to help each other. And it's our hope that by the time we get to mid-August, you won't be able to turn around on campus without seeing a billboard or a digital sign or getting something pushed to your Instagram account that talks about the importance of wearing masks, that reminds folks that we're all in this together. So we're going to do our part to help remind folks that that we all have a role to play. And as leaders, I would ask that you all not be afraid to do your part, to model that kind of behavior. I know you will, but I also know that if we can help you, if Philip or myself or my team can help any of the student leadership, communicate with your constituents, don't hesitate to reach out. I know I've already had the pleasure of speaking with Jonathan a couple of times. I've met Caitlin. We're here as a resource for you also. As you're looking for ways to effectively communicate with students and you want some help, don't hesitate to give us a shout.
Final question I have in terms of communication, and I've sat through these meetings the last couple of weeks, as we talk about the responsibility Clemson has as an institution on reporting COVID test results, data. We've seen examples of it already through our athletic department, very transparent. And President Clements just this week or last week with the members of the local media talked about how important that transparency was. So what can you tell us about that?
Yeah, thanks for bringing that up, Philip. It's a big deal. I mean, because, our credibility is the most important thing that we have here in a lot of ways, right? And so people have a right to know what the situation is. And the president did get up in front of 15 or so reporters last week and put the ball squarely on us to be transparent around communicating results. You're going to see as we finalize and we start to roll out a regular cadence of testing, a regular cadence of communications about those results will follow. We're not quite there yet for me to be able to say that you'll get a message every Friday at 2:00. But once we get the plans developed, the testing plans developed, a big piece of that will be a communication plan for sharing those results. And so, for example, as Provost and Chief mentioned, we tested about 1,900 employees last week. We are very close to being able to put out our first communication about those results. We're just waiting on the last batch of results to come in. So we will start to see us talk about our testing results. We're not going to hide anything. There's nothing to be gained by that. But as we get the plan solidified, the communications will follow.
Absolutely. Well, hopefully we were able to hit on a lot of your questions just now. If we didn't, we certainly plan to follow up with you to get you answers. That is very important to us. At this time, I'd like to turn it over to Jonathan Gadana in CUSG to see if you've got any comments or questions from kind of the undergraduate's perspective.
Yeah. First off, thank you all for joining us today and answering these questions. I know the student body has been waiting for communication such as this, and I appreciate all of y'all's diligence into this and answering all of our questions. For me, and from my perspective, y'all have touched on a lot of the different pieces that came up and that we were kind of discussing beforehand. But I guess one big question I have is, and I know this could be a big question for a lot of people outside of a lot of things. What is athletics going to look like from football to different sports, and kind of what's that going to be? Because obviously that's a big piece in just the student body and the alumni body. So I just wanted to see what y'all's thoughts on over that, and if you could update us with anything on that regard.
Well, I can say that right before this meeting started, the first shoe really dropped, and that was the ACC announced its kind of home and away game revised football scheduling model. And there's going to be, I don't know that they specifically released dates along with it, but you can go to theacc.com to learn more about that scheduling model and what games it looks like Clemson's planning to host 5 home games. What those dates are exactly, I don't know that we've pushed that out just yet, but that was really the first shoe to drop. And that's obviously going to impact a lot of things. From family weekend to move-in to orientation to all these things that we've been planning throughout the transition to coming back to campus. Does anyone else have anything on top of that?
Yeah,
Athletics?
Philip, just to add a little bit more detail, because I just looked at the release before we hopped online. It looks like, as far as football goes, you're looking at 11 game schedule for all ACC teams. 10 of them will be conference games, and you'll get to play one non-conference game against another team that will come to your state. So I would assume in our case, I would assume that would mean South Carolina. We would play South Carolina, but they're looking at starting all fall sports the second week of September-ish. So there are plans to play the non-football sports as well under modified schedules. I did not see specific game dates, but there's actually if you want to know who we're all playing, you can go out there and find it. I don't think there may not be dates associated with it, but they're looking to play 11 football games, I think, over the course of 13 or 14 weeks.
And yeah, it would start that week of September 5th through 12th, maybe, was the first date that they had kind of earmarked for competition to begin. Well, regardless, any fall sports, the ACC came out with an announcement that they wouldn't start until September 1 at the earliest. So we do know that information right off the bat. What else you got, Jonathan?
Another one, I guess it's more with regards to the incoming freshmen. So kind of what's that looking like for them, and kind of when can they expect to get things such as convocation and different communications like that from the university?
We've been meeting just this week about how we can engage that newest group of Clemson students. Obviously, 2020 has been a real tough year for them. They didn't get to experience graduation to finish out their high school careers, and then obviously it's not ideal. It's not an ideal scenario to come into college almost feeling blind, I guess, to the experience. So we're trying to incorporate as many virtual elements as we can to kind of obviously make them feel part of this Clemson family. And we'll have more information coming out on that in the coming weeks. But it began with a note, I think, from President Clemens today. If it went out, I'm not positive on that. Mark would probably know, but I know that was kind of step one of an aggressive approach that we're looking to have both an aggressive social presence as well as kind of a home base, if you will, on Clemson.edu to where to put this information for incoming students to make their transition into the university somewhat feel normal as best as we can during this challenging time.
Perfect. Well, that's all the questions I have. I don't know, Hunter or Caitlin might have some as well, but I just wanted to thank y'all again for hosting it and being here and allowing us to hear these answers to the questions.
Absolutely. Hunter, you got anything for us?
Yeah, I have a couple questions.
Okay.
So I guess the first one is, as students, we're really passionate about the student organizations we're a part of. Are any recommendations as far as like capacity or how we should operate? Will they be released in the coming future to maybe the student organizational leaders? Yeah.
Dr. Miller, do you have any insight?
Yes,
Okay.
yes, Hunter. There is a pretty sophisticated kind of guide, or really rather a guideline, as to what it looks like by way of organizations. And as I said earlier, keeping in mind that with the recommendations from the ELC by way of the CDC and DHEC as to how these organizations will function with regard to social distancing and other kinds of enhancement kinds of tools that will be available to them for any kind of, I guess you could say, meetings or programming or anything like that. But that will be coming out as well.
Thank you. And I guess the second part of the student organization piece is, I think Richard hit on this a lot, but something students really value is the student activity fee. And unfortunately, we are aware that it's going to be taken away from them, unless for at least the fall semester. There are some student organizations that have reached out to me and they've expressed concern because their organization still operates regardless of the current pandemic. A lot of these organizations are isolated. I can name a couple. The dog agility club, the cybersecurity team. My organization I'm pretty passionate about, the bass fishing team. We're in the middle of the lake fishing by ourselves. They're going to continue to operate regardless, and they're just curious if their funding is going to be also taken away due to the current pandemic. And also the second part of this piece is a lot of organizations use the majority of their funding in the spring semester, actually. And, what if this pandemic, is fixed? What if there's a cure? Or is their funding also going to be taken away from the spring semester as well?
Well, I think we do have some options that are available to us. And I know that we're going to engage certainly the Senate in conjunction with the Student Funding Board to kind of talk about what that looks like. Um, I mean, clearly when we talk about credits or refunds and things of that nature, we will be consistent with what the university expects of us, right? And families and parents. But I do think that we're going to have some options that are available because there will be various kinds of funding, that will still in fact be available for that particular term. It may create some sort of nuances for us as we kind of spread it out because you're right, that funding is for the spring term. And it does create some additional challenges. But I have to tell you, I'm really encouraged that we're going to be able to work those things out. Rick?
Yeah, I was just going to clarify. Thanks, Hunter. When I said before, we're certainly not taking the funding away, and we're not, wiping that fee out from the bills for the entire fall semester. It was a prorated amount, and you know, frankly, if that caused unintended consequences for the org, I think I'll apologize on behalf of the administration. We were trying to do what we thought was right with a very fast-moving situation, and I think our thought was that was a fee that at least a good portion of students may not get the full benefit of, and trying to deliver on what we've said in our fee arrangements, which is if you don't get the services, that that's something we would look at bringing up for consideration and refunding. So certainly not taking it away for the entirety of the fall semester or the spring semester. But I think right now the total collections from that fee are going to be down 29% for the fall semester. But like Dr. Miller said, I think what we're certainly that our leadership in student affairs is certainly happy to work with folks to figure out a solution.
I appreciate that. The last thing I just want to leave on is what is the best avenue for students to look for as far as additional information? Is that the Clemson website? Is that a specific email? Is that their advisor going into the fall semester?
Yeah, Hunter, I guess my advice would be yes to all of it. I mean, just like, we got a bunch of different channels. If you want official information about kind of where we're the latest announcements from the university level, and then robust FAQs and that sort of thing about related to the pandemic, the COVID website is the place to go. I know that among a lot of our students, they're not as excited about using email as old people like me are, but I would encourage you to keep an eye on your email, and also know that we're looking for ways too to make sure that we try to communicate where you all are a little bit more, and so we'll continue to we'll continue to look for ways to to communicate effectively. And quite frankly, if you all have ideas of ways that we can more effectively reach students with timely information, let us know. If there are ways that work from your interactions, we want to know that, because it doesn't do us any good to spend all this time and effort creating communications if nobody's reading them.
Thank you again. I appreciate this opportunity for students to ask questions and just kind of figure out what the fall semester is going to look like. So thank you again.
Thank you, Hunter. We appreciate you. Caitlin, we've got a few minutes left. I know we're a little bit over time, but that's okay. I definitely want to get to you. Obviously, the needs of graduate students can differ significantly from that of your undergraduate counterparts.
Yes.
Do you have any additional comments or concerns in the remaining time that we have left?
Of course I do.
I knew that answer, by the way.
I have graduate students. Of course, I have questions. So for me, the major question that I've been asked, which I think is probably the most significant to ask at this point, is, what is our timeline for shutting down campus after September 21st? When are students going to know if we're going to shut down for the full fall semester? When are students going to find out if we're even just pushing it back a little bit? Because I don't want to tell my students, like, we're coming back gung ho for September 21st, and we find out on September 20th that we're not coming back at all. Because that's going to be really important for students who are like looking at apartments. It's going to be really important for students who are thinking they're going to be moving onto campus on, the 13th that week. So that's kind of my first question, if possible.
I can address that. We haven't set an exact date, but pretty much toward the end of August,
Okay.
beginning of September, right at that juncture, we've got to make a go or no go, somewhere right around in there. And as hard as it might be, we would rather have a no go and just that's it, because it's a one opportunity for us to have a really rich experience on campus would be to start then. If we delayed another 2, 3, 4 weeks, we might as well not open at that point. So that's we didn't want to do a wait and see. We're definitely, it's a one shot, and we're very optimistic, but I'm a realist. We're all realists too, and that's how it'll play out.
Beautiful. I appreciate that. So then my second question would be, I know that we're putting the mask mandate into our student code of conduct, and I really highly appreciate that. I think it's a wonderful decision. The question that I get a lot of is, how are we going to enforce it? We have students who are wondering is there going to be like a police call on them? Is there going to, because that situation, especially in the rise of BLM, is going to be highly controversial. We're going to have students who think that mask wearing is political. It's going to be a very stressful situation for our students to be under. So the question I keep getting asked is, how is that going to be enforced across campus?
Let me take a shot at this really quickly, Caitlin. This is what we do know, okay, as it relates to students. And this is not unlike when we went to this whole concept of smoke-free, right? And there were people that would choose to smoke on campus, but how many people do you really see smoking on campus, right? I mean, and that's not because of a tool in the toolbox which would allow for adjudication. It's more about being a part of, once again, this collective community as such. So when we talk about enforcement, we're talking about really egregious measures, right? So if we, and this is just one example, and I don't necessarily like spending a lot of time on it, because the actual infractions that we have as it relates to the collective university campus is really statistically a bit insignificant. Now, I say that in a way that it is significant, right? But when we look at the overall student compliance, when we come to these things, it's more about the behavior of law, right? it's a teaching moment, right? The behavioral law, it's not so much the law, it's more about individual responsibility. And that, if it weren't, I don't know, if we didn't have a law that said you could drive, if we had a law that said you could drive 65 and miles an hour in a school zone, people aren't going to do that. Students aren't going to do that because they're a part of this collective community, this higher plane of consciousness, right? So on the enforcement side is primarily relegated for egregious behavior. If there's a student in class that is habitually or just saying, you know what, it doesn't matter to me what the rest of the class is doing, and a faculty member has no options that are available, that is egregious. And that is absolutely something that we would take into consideration by way of a significant sanction, right? Because it exposes everyone. So that's more about the enforcement side of things in that sense. But I really don't see that. I mean, because I don't see that with any other kinds of mandates that we have in that sense. And if people believe that it's something that's inconsistent with their value structure, then they certainly have options available to them as such. But there is no mask police, right? Things will come by way of OCS the way they normally do, and that OCS will respond accordingly.
Beautiful.
You know,
Thank you
Kate,
very much.
Caitlin, if I could, I think to build on what Dr. Miller said real quickly, we've seen some of that play out just locally in this area over the summer, since, since Clemson put in its mask ordinance in town a couple, 3 weeks ago. If you go into Publix now, as opposed to 3 weeks ago, the percentage of people wearing masks is significantly different, right? And then there's no mask police. Nobody's writing tickets. I do think that people, if people will largely follow the expectations of and want to follow the rules. I do think we have to be prepared to handle those egregious situations like Dr. Miller said. But it's been interesting to me to watch just how willing people are as long as somebody tells them that this is what you have to do. When you leave it up to people, they're not as good. But when you say, hey, you got to do this, the results are pretty good. I mean, and it's striking the difference between going into the Publix here and going into a Bilo in Anderson where they didn't have a mask. It's striking how much different it is, just as one example, right? So I do think that hopefully, we'll make it very clear, and we're going to communicate this is our expectation. And I think you'll find that the vast majority of folks will follow the expectations.
And I truly appreciate that from both of you, because I just happen to know that the faculty were told to call CUPD. So that's kind of where I was coming from is, we say there's no mask police, and, CUPD is so much more than that. They're a wonderful add to Clemson University, and I love working with them personally. I just, those are the questions I've been asked because students are afraid of, police officers being called on other students in their location or something like that. So just with the heightened sense, I just wanted to bring that up and make sure that conversation was being had, even if it's just behind closed doors, so that students felt a little bit more comfortable and confident because, if students' actions are disrupting a class, as Dr. Miller had brought up, to the extent that immediate response is needed, they're being asked to call faculty and staff, as well as graduate students who are teaching, some for the first time in a setting that is in person. The instructor is being asked to possibly call the Clemson University Police Department. So that could be a very frightening situation for new teachers to be going into, or even older faculty members, if their safety is being put, or there's the safety of their other fellow students are being put in jeopardy. So I just wanted to bring that into the conversation. And then one final question, I promise I won't hold anyone else past that point, was just at one point in time, it was brought up about the contact tracing. And I just wanted to know when the contact tracing is actually going to be implemented, because I have students who are telling me that their roommates were tested positive for COVID and that they've not been contacted. So they just want to know when that information is going to be passed out. When is that going to be worked through? Because they went to MUSC and Clemson. So that's just the last question, is when is that contact tracing going to actually be implemented for our university?
And we had answered them all right up to the very end.
So can I take a shot, please? Thank you. So, Caitlin, thank you for the compliment. I appreciate that as always. And I can tell you that I have been very vocal about your concern. Initially, there was some direction that was rumored around that the police department was going to be the masked police, and I very quickly put an end to that rumor because that is not what we want to do. We do not want to create that scenario or that situation where people feel like that if they see somebody walking around without a mask, that the police are going to show up. Simply for what you mentioned earlier, is the dynamic that we're dealing with right now. That is not a good scenario for anyone. So obviously, what we are going to be encouraging is what we do on all of the things that we talk about is voluntary compliance. We certainly want peer compliance as well, and some help with the peers to try to make this thing work. And we've also worked with the academic side of the house to actually provide some direction about if someone doesn't want to put on a mask, there's some alternatives that can be utilized before the police would ever be called. And the only, from my perspective, the only time that I want the police to be called is if there is a immediate emergency, which would be the same for anything. If there's a disruption that would lead to some sort of physical violence or someone potentially being hurt, I would want the opportunity for the officers to be able to respond and try to de-escalate that situation. And again, minimize any kind of negative outcome for the teacher, for the student, for those that were in the class, because we've worked really hard with help from people like you and others to create a relationship with students. And I don't want to destroy that over this situation.
Mm-hmm.
That's the first piece of your question. In terms of the contact tracing, there's been a lot of discussion about that. In terms of, we've heard that students have been tested and they have not been contacted in terms of friends or theirs that have been given test results that were positive. So if it's on campus, if it's a person that's on campus, then Redford and the Sullivan Center are maintaining that contact tracing. And I feel like based on my conversations with them, we're doing a pretty good job of making sure that we're contacting all those folks. Once we are notified, a lot of that is not an automated system. So if somebody gets tested off campus, that goes to DHEC. It doesn't automatically go to Sullivan Center or Redford for a contact tracing. So what we're working on right now is an automated system of how that automatically gets uploaded to the university, and then we can be coordinating with DHEC. But I can tell you that the people that have been getting positive results on campus, Redfern and Sullivan Center has been contacting them and tracing, because I get that update every day. We're trying to work through the process to make sure we're getting notified appropriately by the testing facilities. And then if somebody is tested off campus and gets notified of a positive, the direction is for them, if they're students, to contact Redford and notify them. And if they're a staff member, they're supposed to notify Sullivan Center. So there is a lot of contact tracing going on, and we're trying to work through all that process to make sure that nobody's falling through the crack. But there is a difference between DHEC, which is an off-campus contact tracing process, and what's going on campus.
Beautiful. Thank you very much. I appreciate that.
Thank you for the questions, Caitlin. To our panelists, our students, our guests, I think we kept this thing under 90 minutes, so there you go. Thank you all for coming. Again, we do plan to share a recording of this town hall with our entire student population very shortly. We appreciate your participation and interest and look forward to seeing you soon. Any other parting comments from the university leaders?
Enjoy the rest of your summer, gang.
Let me just say again how much we appreciate the partnership we have with you. And that's what it is. It's a partnership. We're in this together.
And Provost Jones, I'd like to echo that too as well. I specifically want to just reiterate just the level of commitment that the leadership has shown since day one of the pandemic, being Hunter and Jonathan and Caitlin, has is beyond reproach. And we really appreciate you being actively engaged with us during this entire time, and we will continue to do so. Your involvement is incredibly important, and we look forward to seeing you all back on campus.
Thank you all. Have a good night.